everyone, welcome to the New Teeth Now webinar. I'm Bianca and I'm here with Dr. Kirkpatrick.
Hey Bianca.
And we are so glad you've joined us tonight. We're going to be talking all things New Teeth Now dental implants, from the process to patient testimonials and everything in between. And we'd love for you to ask questions. So if you are on YouTube, you can just type right on our chat and we'll be able to see those and answer those for you tonight. So highly recommend sending us a question. But before we get into anything, we're just going to jump into a patient video about a girl named Patience. And her surgical story, basically telling part of her journey on surgery day and a little bit after.
Yeah, and she's very, very good and articulates kind of what she went through here at our office very well. So I think it's really cool for you as potential patients, seeing our patients tell her story about coming here to New Teeth Now. So we'll kick off the webinar with that little video, and then we'll start answering questions and going through some slides and hopefully get you guys a bunch of information and answer all your questions tonight.
I'm a little nervous, but I'm super excited to get this little journey started. Today I'm going in for pre-op. I'm going to get some pictures of my mouth, get a game plan for surgery on Thursday.
Hello. Hi.
It's everything I expected. I think it may be a little bit more than I expected. I've always been confident in my decision, but coming here and just meeting everybody, I'm, I guess, even more confident, more comfortable. A lot of information at once, but she explained it so well. I feel very comfortable about everything. So this is the first set I'll get, and it's very nice. She didn't show me this set yet. I was like, yeah, I like that. But then she showed me this one, and I was like, oh my God. This is like the Cadillac of teeth. This is nice. And I don't know how to explain that unless you need teeth. Like, these are really nice. And these aren't even permanent. These are just temporary, so.
So we were able to see Patience today for a consult, and she's kind of describing her history and kind of her journey with her teeth and having to have all the upper teeth and all the back lower teeth removed. She had an upper denture made, which she wears pretty routinely, a lower partial that she just can't stand and never wears. She's very fortunate. She's got enough bone to do the procedure and have the implants placed. She needs a little help in the back part of the upper jaw due to the location of her maxillary sinuses, and probably also a combination of having the teeth removed. The bones shrank up a little bit, sinuses have dropped, so she needs one zygomatic implant on each side in the back. I think, so she's a pretty straightforward case for kind of the surgeries that we typically do and the experience we have with the zygomatic implants. And there's not a lot of people that are actually routinely putting in the zygomatic implant like we are. And she's pretty straightforward.
Dr. K was very chill, very laid back. He made me very comfortable, almost like a friend. I feel more comfortable about surgery. I definitely am happy with the choice I made to come here. That was a lot better than traditional impressions. This was a lot more comfortable. I didn't have to gag or choke on any rubber substances. I think with each step I'm getting even more excited. I just picked out like the shade and the size, and it's starting to set. It's really starting to set in. I'm really excited.
Day of dental implant surgery. I'm so nervous but so excited. I'm saying goodbye to my last little bit of real teeth. A little bittersweet goodbye. I'm so excited.
I'm going to take all of this to your primary recovery area, and what you're going to do, you have a seat right here. That wasn't supposed to happen.
Long time coming.
Take very good care of you, okay? See you when your surgery's all finished.
Thank you.
You're welcome.
Okay, the day's here now, so we're all excited. So she's going to have both upper and lower done. We're actually going to do one zygomatic implant on each side to give her a lot of stability so she can get rid of her denture and have this full implant supported bridge in that can last her the rest of her life. I'd say somewhere around like 3 hours. 3 hours for the surgery. That includes removal of the teeth, cleaning everything, making sure there's zero infection in her mouth. We've got the temporary teeth ready to kind of use as a guide today, placing the implants and then scanning everything so the lab and Dr. Nafal and the restorative team can design those teeth that will go in at the end of the day. Yeah, so we're all finished. One zygoma on each side, 4 traditional implants in the front and the middle, 6 regular implants on the lower, all went in tight, spaced perfect. I mean, she should get a great result. She'll go shortly to the private recovery room, and we're just waiting on the lab to finish designing and making her teeth. Let me help you. Let me help you. Yeah, now bite. Not removable.
Thank you.
Done now. Like, she did such a great job talking about everything that we do here. I don't really know what else I can say except answer your questions, but no, we'll go through a lot of different
It does
information.
give a really good like synopsis of like the beginning of the process and the day of surgery and everything. Like
Yes,
Yeah.
she did a great job with that video, and you guys did a really good job with the filming and just the whole movie making, Keith. Like, you go. So, you know, I've seen that video before, and I always pick up different things where I'm like, yeah, that's kind of an interesting comment from a patient. She talked about like coming in for the impressions, and she's like, wow, that's a lot different. I don't have that getting choked on that rubber material anymore like I did in the past. And that is, you know, it's just one little thing amongst the 100 other little things that we do here that kind of separates us from a lot of other offices. And, you know, what she was talking about, I don't know if you saw the surgical assistant using the camera. So basically they were scanning the inside of her mouth, her gums, her teeth that she had on the lower, instead of taking impressions where you mix up that gooey stuff and stick it in your mouth and kind of wait 3 or 4 minutes for it to harden up before you take it out. And usually patients can gag and get choked on that. We use everything's digital. So it's like a camera that goes in and scans everything. It's very fast and it's a lot more accurate.
yes.
And you don't have that material in your mouth that everybody gags on. So that's just, you know, one thing I saw her mention and talk about that I was like, oh yeah, that is kind of cool that she picked up on that.
Mm-hmm.
We talk about it, but it's cool to hear patients really kind of understand that part. When you go through it, you kind of feel a little bit more and understand a little bit more about what we're talking about when we say we're different. So, you know, this is her 4 days post-op, and it's when I was seeing her right before she was going back home. And she looks great. You know, she's swollen. She's definitely swollen mid-face and kind of the lower jaw area. But she was doing really, really well. And it's only 4 days after a total, pretty much mouth makeover. And the zygomatic implants. And a lot of people will ask me on a consult if I tell them that they do need the zygomatic implants. They're like, oh, does that mean I'm going to get a lot more swelling and bruising? Mm-hmm. And my response is usually like, everybody's different. You know, well, I've got patients who I do not put any zygomatic implants in. And I see them back and they may be really swollen and bruised. And then patients that need 4 zygomatic implants, which is about as invasive as this procedure can get from an implant standpoint. And they come back in a week and it looks like they've had nothing done.
Yeah.
You know, hardly any swelling, no bruising, and they're doing great. So everyone's different. I always tell patients to expect some swelling and bruising, and then we give you some things to do during the first like 2 to 3 days to really help minimize any bruising and swelling. And if you do those, it's usually a pretty easy process to go through. But I always tell people to expect that. But pretty much what you see with her, that's typical.
Like normal.
And pain-wise, we give patients a couple different types of pain medicine. And most people that go through this process, they'll come back and they're like, I really didn't have that much pain. It was just uncomfortable because of the swelling that I got. And they'll say that ice packs really helped, pretty much took away any pain. They just didn't like the swelling if they get it. But it's typically not a very painful procedure to go through.
And it's such a short period of time that you're feeling that, and then it's
Yeah,
like it
and then
didn't
it's
even
over.
happen. So just got to push through that. week or
Exactly.
so, week or
And a
so.
lot of times my first visit back with patients is typically like 7 to 10 days. And when I see them back, I'm like, well, you look great. And they may have just a tiny little bruise here. And they're like, well, I've got pictures. You should have seen me on day 2. And they're like, but then all of a sudden, they're like, man, I thought I was really swollen and bruised. And then it's like gone. Like it just went away really fast. So it is, it's a lot of work that we do, and we're accomplishing a lot because, we're doing a total makeover, with a stable bridge, upper and lower jaw that should last you forever if you take care of them. And to think about all the work we're doing and exactly what we're doing to get you that result, the recovery is not bad at all.
Yeah,
Yeah.
definitely.
So we'll go through some slides, and this is kind of like a before and after of a 3D picture of her surgery. You can see the lower teeth there, the upper jaw, there's no teeth because she was wearing a denture. And, I've had some comments like, well, why did she do this? Her upper teeth looked okay. And I'm like, well, it was a denture. Of course it looked okay.
Right.
But she hated it because it was big, bulky, covered almost the entire upper jaw. And she had used denture glue to keep it in. She couldn't eat the things she wanted. And it affected her speech. So now she has these 6 implants on the top. She was fortunate enough to get 6 implants on the bottom jaw. And now she has bridges screwed into these implants, super solid foundation. And once her bone has fused to these implants, which takes 5 to 6 months for the upper jaw, then she can eat anything she wants. And she pretty much treats them like natural teeth.
And we are going to come back to a post-op for 1 month later, so you'll be able to see basically her whole transformation in just a little bit. So
Yeah, and
stay tuned
it's
for
a great video too.
Yeah.
Because it really shows her 1 month after, and she talks a little bit about that 1 month process. Yeah. So a little bit about me, just in case you guys haven't been to the website or you have not attended one of these webinars before. Originally from Kentucky, did all my school at the University of Kentucky, and then did surgery at University of Florida in Jacksonville, and highlighted and bold there that I am a board certified oral and maxillofacial surgeon, as are the other oral surgeons that are with us at New Teeth Now. And I think that's very, very important. If you're thinking about doing this type of procedure, or really any type of procedure, you want to make sure that the person that's treating you is board certified in their specialty. And, we are oral and maxillofacial surgeons, and that's being board certified is how we make sure that everybody's accountable and up to the same level of treatment and doing the right things to patients. And it's not easy to become board certified. So these 3 key differentiators, I talk about this a lot on webinars and in consults when people ask well, what makes you different? How are you, different from Clear Choice or Nuvia? And it's kind of these 3 things. So all of our patients are treated under general anesthesia. We have a totally separate anesthesia team. They're very, very experienced, very good at what they do. And all of our patients are totally under general anesthesia. And what that means is, yes, you're asleep, and a lot of other places will tell you that you're going to have this procedure asleep, but there's a big difference. And you need to know that difference, because when most people say, oh yeah, you're going to be asleep throughout the procedure. They're talking about IV sedation, not general anesthesia.
Right.
And the difference in that is with general anesthesia, it's pretty much like any other outpatient procedure that you would go through. Whether you're having a gallbladder removed or doing our New Teeth Now procedure, you have a breathing tube placed that's securing your airway. That makes it very, very safe and lets us control your airway where things can't accidentally fall down into the airway. Some of the fluids, like your spit, any type of blood. I mean, patients don't bleed a lot, and then the irrigation that we use, or any of the instruments. If you Google instrument dropped in mouth during dental procedure, it's all over the place. We
Avoid that.
We avoid that by having our anesthesia team place an airway, just like you would have done in an outpatient surgery center or hospital. So it lets you undergo the procedure in the safest way possible that we feel like. When you're under IV sedation, you do get an IV, you do go to sleep. They usually use propofol, which is like the Michael Jackson drug. It's one of the best drugs ever invented, super safe, but you don't have a breathing tube placed. And when you don't have that breathing tube in, then you're relying on your reflexes to protect your airway. And if you get a little bit too much sedation, then you can't do that. So if spit or fluid goes in the back of your throat and tickles your vocal cords, they slam shut, where you can't cough anymore. And then that becomes more of an emergent situation. IV sedation is safe, do not get me wrong on that. But for a procedure like this, where you're going to, this may take 3 to 4 hours to do both upper and lower jaws,
It's complicated.
then you really want it done in the safest way possible, and that's under general anesthesia. The other key differentiators are we do zygomatic implants pretty much routinely here. We only do them on the patients that need them, so not everyone gets them, not everyone needs them, but we see a lot of people who've been other places that without zygomatic implants, they can't do this. So they end up finding us because they know we have a lot of experience with the zygomatic implants. And I was told by a lot of the different implant companies that we do on a multiple more than other places combined. And that's, it's not that we just do them on anyone. We just see a lot of patients that come in from all over the country and other countries that need the procedure.
From it because we do it so often.
So we do that pretty much every day. And then the board certified oral surgeon, just do not forget that whether you're coming here or going somewhere else. These 3 things you should ask about. Yes. Am I going to be put to sleep under general anesthesia? Who's going to be doing that? Is it a separate anesthesia team? How many zygomatic implants do you place if I need them? And am I being treated by a board certified oral surgeon? If they can't give you good answers on these 3 questions, then look for somewhere else. So the upper jaw, this is typically how we do this. We routinely do 6 implants on the upper jaw to secure the bridge. And when I'm talking about the implants, and a lot of patients will get this confused sometimes, they think the implant is the tooth. So the implant is actually the little screw that you can see shaded out there. Those go into the bone, so they anchor into the bone to give us something to secure your bridge on. These 6 implants secure the entire 12-tooth bridge on the upper jaw. The lower jaw, the gold standard is 4 implants, so we do 4 implants, but if you have enough bone to do 5 or 6, I routinely do 5 or 6 implants on the lower jaw, even though all the literature talks about 6 implants on the upper is gold standard, 4 implants on the lower. And this is how one of my lower jaws would look like. So 4 to 6 implants on the lower jaw, securing the entire 12-tooth bridge. The zygomatic implants for patients that need those, they're essentially the exact same thing as a regular implant. They're just a little bit longer and they anchor into a different bone. The zygoma is your cheekbone. So these things kind of reach out and touch the zygomatic bone, and they're angled a little differently. You can see that here. And that enables us to do this procedure on people who just do not have enough bone in the upper jaw to otherwise do this procedure, either not at all or not without some significant bone grafting and some pretty invasive procedures.
And if you've been anywhere where they turn you away because of bone loss, that's where you need to come to New Teeth Now.
Yeah, absolutely. And we see patients, I wouldn't say every day, but I mean at least a couple times a week, where they come in for a consult and they're like, you're my third opinion. I've been to 2 other places. They told me I just couldn't do this procedure because I didn't have enough bone. And, they kind of gave up hope, and like 6 months later or a year or more, they keep seeing our commercials saying that, if you've ever been told you don't have enough bone, call New Teeth Now. And we're not just saying that. I mean, I'll come into the consult and that same patient that's been told multiple times they didn't have enough bone or they just weren't a candidate for this procedure. And then I look at their CT scan, do my quick intraoral exam, and I'm like, you need 1 zygomatic implant on each side, but we can easily do this. Pretty straightforward. And a lot of times patients will look at me and be like, they either do a couple things. They look at me like I'm crazy and like, what do you mean? How can you do that and they can't? And then I go through and show them on their scan how I can do it with zygomatic implants. Or they'll kind of get a little tear and it's like they've just been waiting for somebody to tell them that they can do this.
Yeah.
And that's pretty common. I mean, we see that a lot. And we are very, very happy and blessed that we can help patients who just don't have enough bone to do it otherwise.
We did have a quick, well, it's not really a question, but something we could talk about.
Sure.
From Carol. She said, I haven't been to a dentist in years, so I'm not sure I would even be qualified for this.
So, and there's a lot of different ways I can approach that question without knowing exactly your personal situation, but just in general, patients who typically haven't had, their every 6-month cleanings, especially in years, then you've probably developed periodontal disease or some bone loss around the teeth, and you probably would be a candidate for that or for this procedure. But what I would encourage you to do, either see a general dentist in your area, a very good dentist, or just come see me for a consult. Schedule an appointment. Come in. If I see you for a consult and I feel like that you're not a candidate for this procedure, not because you don't have enough bone, but because your teeth are just not that bad, then I'll either refer you to a good restorative dentist that I have a relationship with, or tell you, we'll try to find you someone close to your hometown that you can see and just, save your teeth. This is the greatest procedure ever if you need it, but we don't have anything that's as good as your natural teeth if your natural teeth are good. And what I always tell patients, that if you're going to go, because we do see some patients who they've been to several other consults and they've been given treatment plans where it's a couple pages of a treatment plan where it's just a lot to go through and fix and restore their teeth. And they're like, I just don't know if I need to do that, or should I do that, or should I just have them all taken out and do this New Teeth Now procedure? And what I tell them is like, it doesn't really matter, even if you need a cavity fixed on every tooth. That's really not the point or the deciding factor for me. What I tell patients to do is, if you're on the fence and you're just not sure, should you do New Teeth Now with me, or should you go to your general dentist and have everything fixed? And you're kind of sitting up on the top of the fence. Which way should you fall? Then I'd tell you to go back to your general dentist, or we can refer you for a second opinion, and let them look at the treatment plan, let them look in your mouth. And if they tell you that, yeah, we think we can fix everything, then the number one question you should ask, if I go through the 1 to 2 year treatment plan with you, spend the time, spend the money, get everything fixed, then what's the end game and what's the prognosis?
Like how many years till the next stage?
Yeah, and if they can't give you a good prognosis in terms of years, that, hey, if you do this and you come in for your cleanings and you start taking care of your teeth better than you ever had, then, and they should last you 15, 20 years, that's your answer. You should save your teeth. But if they can't give you a good answer to that question, like the prognosis of their work, then the New Teeth Now procedure is your best answer.
Yeah, that makes sense.
And that's, that's pretty much that's just my honest opinion of how I would tell a family member to look at it. So before in zygomatic implants, we see a lot of people like we talked about that need this procedure. And this young lady, we post this picture a lot on our webinars because I think it's a good story to tell. I mean, she came from the northeastern part of the U.S. She flew over, no telling how many clinics, dental clinics, oral surgeons, and there was no one in her area. And she lives in a huge city, a big city, and just could not find anyone that could do this procedure on her. So she found us, she came to Florida. We were able to do this pretty easily. And her teeth there, that's her natural teeth, or the bridge that she had, and it was failing. And she, in her words, would be devastated if this thing fell out. And it was going to any day, because you could literally just move it up and down with your fingers. And we were able to do this procedure and do pretty routine stuff for us. She just needed one zygomatic implant on each side, 4 traditional implants, 2 in the front, 2 in the middle, and kind of around the nose and around the sinus. And she got a tremendous amount of support, and that's her after picture. And now she's got a stable bridge. She was able to keep her lower natural teeth because she didn't need the New Teeth Now procedure down there. So I talked to her about keeping her lower teeth, and she got the new bridge on the top, and that's her after result. Now this patient, a little different. So you can see failing lower teeth, lots of bone loss around the lower teeth. They did have that little wisdom tooth on the lower left side of the screen. That tooth, there was nothing wrong with that. It was completely covered in bone. And anytime I see that on someone who's out of their teenage years, then I never just go searching for a wisdom tooth to remove it, because you can truly open up Pandora's box and cause more problems than it is to keep the tooth there. So we left that tooth, took out the remaining teeth, put in the 4 implants on the lower jaw, the 4 zygomatic implants, which it's called a quad zygomatic implant case. And, on an otherwise patient who had been told and when I tell you this is what they told me, decades, that they didn't have enough bone for implants. They gave up hope. They just tried to use their upper denture as well as they could. They pretty much invested their retirement fund in dental glues, and they just finally came in for a consult, and we were able to get, implants in and a stable bridge. So now we're going to let patients kind of go through a little video and talk about her experience 1 month out from New Teeth Now. And I love that picture.
Yeah, isn't it
just that 1 month after photo of her is so good.
Yeah.
Her teeth look amazing. She looks great. And, she's holding her before picture, and that's just a big difference.
Mm-hmm.
I woke up and I was able to smile so big. I am 8 days post-op from having full mouth dental implants. I'm still really bruised and swollen on the bottom, so I haven't got a full look at the real smile, but I cannot believe this was me like 7 days ago.
Today, on day 36, I feel great. I feel like I didn't even have surgery. After surgery, I posted my whole journey online, the good, the bad, the ugly, and to see all the really positive and supportive comments, I think it helped me heal that much faster. I mean, if I didn't see those x-rays for myself, I guess I wouldn't really understand what was going on in there or what I had. And a lot of people didn't even know that zygomatic implants were a thing. So a lot of response was, oh my gosh, no wonder you were so swollen, because you literally have implants all the way up, in your cheek. There's been a lot of changes, a lot of good changes. They're all positive changes. Being able to feel the roof of my mouth is a game changer. If you don't know, like with a denture, you have a full top plate, so
re-experiencing food with my mouth like uncovered on top, it's been crazy. Like, I didn't know that food tasted different when I had the denture. I do like the fact that I come back to get adjustments because my mouth is constantly changing as it heals. So with every step of the way, they're here to adjust my teeth and make sure they fit correctly. Just being free and clear. Like I said before, I'm free. I'm not hindered by any type of mouth pain anymore. It's very fulfilling to know that I never have to deal with any of that again. It's been the best choice I could have ever made for my mouth. Having like the perfect bite, the perfect smile, it's life-changing.
She looks great.
Yes.
Yeah, and she's doing really well 1 month after. And then, she's talking about some of the changes. She's coming in for some little adjustments here and there, and there's not a lot. We let you go through that first 5 to 6 months to let your bone cells fuse and grow and adapt to those implants. And then that literally, it does take the 5 to 6 months for that process to happen. Once it does, though, then those implants are locked in, they're yours, and then we start that process of making your final bridge. And with her, some of the things that she was talking about, some changes that her mouth is going through during the healing, where your gums shrink. And that's another thing that we do here. It's just a little thing. It's very easy for us to wait the 5 to 6 months. And there's some places that will put their final teeth on. They'll do this procedure, and they actually talk about it like it's this great thing, and they're super special to be able to do this. And if you're, from a patient standpoint, it sounds really cool, but it's horrible. It's super easy to do. It's the cheapest and easiest thing to do.
To put your teeth in 2 days later and be
put your final teeth in. We can do that too.
Yeah.
There's nothing special about it. You just make your final teeth and be like, okay, here they are, good luck. But we know that you're going to go through those changes, and that we can get you something that you're going to love a lot better. That you're going to be wearing for decades, that you can be very happy with. And what I'm talking about is the day we do this procedure, your gums are here. The bridge goes in and it goes up and just touches the gums. Feels great. Then you heal, and over the first 2 to 3 months after surgery, so patience is just starting to get to this, the gums start to shrink. Well, your bridge can't be screwed in any tighter. It's it's setting like stilts on those implants. So you can't screw it in tighter. So we let that process happen, and your gums will shrink. You'll get a space in between the bridge and the gums. And it's not terrible, but it's one of those things that you're not truly happy with. And when I see patients for different post-op appointments and follow-ups, they'll be like, oh, everything's going great, but food gets stuck and I feel air escaping when I'm trying to make certain sounds or speech. So I have to kind of concentrate and focus on making sure I'm not lisping or spitting when I talk. And, they understand, because we talk about it in the consult, that we're going to make that a lot better. So once your implants have totally healed and your gums have gone through that shrinkage, then we re-scan the inside of your mouth. Now we've got a new record of your happy, healthy gum level, and we make that final bridge. The restorative team in the lab make your final bridge to go up and just kind of kiss that gum tissue again. So it closes that space. They become a lot more comfortable.
It's a lot better.
The speech improves, and patients, it's a huge difference, and they're so much happier in their final teeth. And they don't even really know how happy they're going to be in those final teeth until they get them. And then they always look at me and they're like, gosh, I'm so happy I came here and not to X, Y, and Z, Nuvia clear choice, because they're putting your final teeth on the same.
And then you'll always have that gap, or you have to pay for
and
a whole
you've
new
got
set of
that
teeth or something.
exactly.
Yeah.
And that's the little asterisk by some of the procedures they do. Oh, they can fix that, but you got to come back in, and usually you have to pay to get that gap closed. Where if they just did it the right way the first time, let everything heal, let your gums shrink, and then make your final set of teeth. That's how we feel is the best way possible to do this. And that's how I would want it done to me. So Who's a candidate for this procedure? Well, of course, if you have no teeth or you're unhappy with your dentures, if you have a mouthful of bad teeth, if you have severe periodontal disease, and definitely, like we talked about earlier, if you've ever been told that you do not have enough bone for implants, call us, schedule an appointment to come in and see me. It doesn't cost you anything to come in for a consult, and we can do a CT scan. It's just your time, and then you'll find out exactly what we can do, because you're going to see it on the screen. As I go through your CT scan, you're going to see exactly what I'm looking at. It's just not going to be me walking in and being like, oh, hey, I saw your CT scan in the other room, and here's what I can do. You're going to see it, and we're going to treatment plan your case together. Once again, the 3 key differentiators: board-certified oral surgeons, a lot of experience with zygomatic implants, and you're under general anesthesia with a very competent and experienced anesthesia team. Our implant coordinators here in Lakeland, we've got Shauna, Chastity, Allie, and Crystal. All 4 of these young ladies are very experienced. They all have been on the other side of the procedure, so they've sat chairside and been surgical dental assistants. So they've kind of been on that side, so they know what patients have really gone through. So when they're talking to you as an implant coordinator, they have a lot of knowledge about this procedure. And usually when I come in the room and we get to questions, they're like, I did have like a couple pages of questions, but like Allie answered everything, or Crystal showed me that. Shauna went through the process, and that tells me that they're all very good at what they do, and they're really giving you a lot of information that when you come here for a consult, and we hear patients talk about this a lot, they're like, well, nobody's really gone over it in the depth that you guys did. And that kind of takes me back a little bit, because it's not a really invasive procedure, but it's a big procedure and a big decision and a big commitment for you as a patient to come in and do this. And I would want to know exactly what's going to happen to me if I were having this procedure done.
I feel like the more you know, the better decision you make, and the more
100%.
comfortable you are with everything. And
Yeah, you'll know exactly what you're getting yourself into. And then
we did have a good question.
it's good.
Hi, what would you consider the best brand name water pick for the implants?
There's really, so people ask me that about water picks, toothbrushes, mouthwashes a lot. It's not really the brand of the water pick. It's more the old saying that, I've got 5 toothbrushes, but I never brush my teeth.
Right.
I've bought an Oral-B, a Sonicare, a Quip, whatever the other brands are, but I don't really use those. I just use a manual toothbrush. It's not really the brand. It's more just using the water pick, whether, patients really like to use the water pick in the shower. I guess there's some that you can hook up to the shower head, because sometimes I guess water picks can be pretty messy. So they'll do that in the shower, and that way there's really no mess in the bathroom. We've got patients that have the ones that you plug into an electrical outlet, that have rechargeable batteries, their own little water reservoir that's actually on the water pick itself, or one that has a separate water reservoir. It's more actually using it and using it appropriately in the brand. Yes. And the same thing with the toothbrush.
But we do give you a toothbrush or a
toothbrush and water
toothbrush
pick.
And a water
Yes.
pick if you have the procedure. So you would take that home with you so you can get started with it once you're allowed to.
Yeah, and we walk you through that whole process.
Good question.
Any others? Okay. Well, send in those questions if you guys have them, because we
Yes.
definitely want to make sure that we get you some answers. So our restorative team, Dr. Nafala, Dr. Dibbs, and Dr. Perez, same with the coordinators. These 3 people are very, very experienced. They pretty much do all these cases with us. And when I say that they've done thousands, they've done thousands of these. And what that means is they've got a lot of experience. They've kind of been there, done that. Any little surprises that may come along the way on those rare days or rare instances, they've probably seen it and they know how to correct it and just fix it without too many problems. And we are going to let Dr. Dibbs talk about the importance of being here. You know, the other thing, we haven't really mentioned this yet, but everything is under one roof.
Yes.
So we've got, you know, you come to our office for the consult, your pre-op, your impressions, the restorative team, the implant coordinators, the CT scan, the surgery, the recovery. Even your teeth are made here. The lab is here. And Dr. Dibbs is going to go through the importance of that entire team being under one roof.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So this is me and my team. And when you come here, you know, another thing about coming to this office, you know, whether you see me or Dr. Richards, you're like, if I see you for the consult, I'm going to be with you with these three young ladies pretty much throughout your entire process until you have your graduation day with me. And that's usually around the 5 to 6 month time frame. So my job is to get you through the surgery and the recovery, the healing, and your implants fused. And then I turn you back over to the restorative team in the lab to make your final set of teeth. So you will get to know us pretty well. Like if I'm the one doing your case, then you're going to be with me, and it's not going to be me doing your consult, because we do hear this from patients time to time, that they go in and they're like, well, the person that did my consult was not the one that did my surgery, and they're not the one that made my teeth. And then when I go in for my follow-up appointments, I never see the same people. Like, I don't even remember who did my surgery. Mm-hmm. You know, so when you come here, it will be, you know, if you start with me, you're going to be with me throughout the entire procedure until you're healed. And we think that continuity of care is very important, and patients tend to like that a lot instead of getting bounced around.
So we did have another question, and just a nice comment from Mike about he had his surgery and he should be getting his finals in October. That's super exciting.
Yeah, okay.
Thank you for commenting.
Yeah, absolutely. Oh, yeah. And he did great. He did very, very well, and, you know, it was a big change for him. I know he's nervous about coming in and having that done. But he did great, and he's doing exceptional through the recovery. And, October's going to be great. So we'll see him probably around that time frame or 3 or 4 weeks before that for his graduation day. And what happens during that appointment...
You call that graduation day.
Yeah, it's kind of like graduation
that.
with me.
Yeah.
But what happens is I do an intraoral exam, look at the gums, make sure that the gums have healed really well around all those little abutments like the implants in the mouth. And then we do a CT scan, and that's your final CT scan. So I look at the bone level, make sure the bone is healed really well around the implants, make sure your gums look exceptional, and if they do, then you graduate. You go back to the restorative side. You graduate from the surgical side. And, it is extremely rare for me to go in and see a patient and they're not graduating. Mm-hmm. There would have to be something went wrong, and I can't even remember the last time I saw a patient that didn't look great and graduated. Mm-hmm. Yeah.
And then the other question was, wouldn't chewing even soft food put the implants at risk of not fusing to the bone? Wouldn't a liquid diet for 6 months be safer?
No, I don't think it'd be safer, and there's a lot of studies out there that, look at chewing and chewing force, and there is that kind of that fine line of what's too much, mm-hmm. but we want to put the teeth on because a bunch of reasons. You'll be very, very happy with the fixed bridge on while the implants are healing, other than wearing a denture while your implants are fusing with the bone. But then there's some research that shows a little bit of activation, kind of loading the implants immediately and letting your body just kind of start adapting to them. A little bit of activation actually lets the bone fuse a little bit better to them. And there's all kind of research on putting teeth on the same day and showing extremely good results with the implants fusing very well with the bone. But we do put you on somewhat of a restricted diet, and it's nothing really bad. It's just anything, my rule of thumb is anything you can easily cut with a fork, that's what you can have for the first 5 months. Once your bone has fused to the implants, then I turn you loose and you can have anything you want. Anything you should eat with healthy natural teeth, you can eat with these once your bone is fused.
Perfect.
All right.
That's good.
Excuse me. So the entire New Teeth Now process, first appointment is you call and schedule a consult. And then if you decide to move forward with the procedure, your next appointment after that is your pre-op and impressions. That's where we do this intraoral scan, get the models, and from those models, we make your temporary teeth that I use in surgery to kind of guide me on placing the implants and the angle the implants go in. And then your, of course, next appointment would be for your surgery. And then any post-op appointments and adjustments that you would need during the recovery, placing the final teeth, and then just care and maintenance. And the care and maintenance is very easy. It kind of goes back to the way it would be with your natural teeth. Every 6 months, you need to come in for your cleanings, where we look at your gums, make sure everything's doing well, no food or any particles are trapped between the bridge and the gums, and just make sure that the screws stay tight and you do well every 6 months. That's how you predictably can keep these things for a lifetime.
Yes. We had a good question come in just now.
Perfect.
My teeth cracked due to grinding. If I get implants, do I need to get a night guard?
That's a great question, and it's one that we kind of treat everybody individually with that in regards to night guard. So some people who clench, grind, break their teeth, or wear their teeth down to, and I've seen people that wear them down to nubs, basically to gum level. But a lot of times it's because of their occlusion, the bite, the way the teeth come together. And if you grind because you're missing some teeth or your bite's not real balanced on both sides, then your jaw muscles are never happy. So they're constantly trying to find that happy spot and they clench and grind. If that's the reason, then doing this procedure pretty much is your night guard. by reestablishing your bite and giving you a really solid upper bridge matched and married to a really solid lower bridge solves the problem. Now, if you're grinding or clenching your teeth because of stress from a job or whatever else is going on in life, then this is really not going to fix that. It's not going to make it worse. It's just not going to stop it. So if we have patients that they continue to grind, once you're in your final teeth, then we can make you a knot guard. And that's no big deal. I mean, we do that a lot if patients need them.
That's a great question.
Yeah, that is a good question.
And we only have a couple more slides, which I'll get into. So if you have any more, go ahead and type them in so that we can answer them before the end of the webinar.
Perfect.
And I'm going to go into some resources. So after this, say you want to watch another video or see some before and afters, go on to our Facebook or Instagram. We have a TikTok and then YouTube, which you're here. And you can watch other videos, see before and after photos, just lots of great content to learn more details about how this procedure is and hear from our patients. And then if you are on Facebook, we have a New Teeth Now community group. You can join that and speak with other patients who are going through the experience. So it's like people who are just, learning about everything versus someone who's had their implants for 10 years. People of all kinds are in this community, and they are more than eager to talk with you and share their experience. And it's a really great place. And I when you mentioned the graduation day, I think someone had posted like yesterday or the day before their graduation meal. It was steak and potatoes, and they were so excited to just eat a steak and enjoy that. And I thought I was like, that's so nice. I love that.
Yeah.
But yeah, so great resources. And then, so if you call us at 1-800-615-5838, Lisa's on the phone. She is amazing. She can get you scheduled for a consultation or just answer any other questions that you may think of. But we are excited to talk to you guys, and thank you for joining us tonight.
Yeah, absolutely.
For sticking around with us, and we hope to talk to you soon.
See you guys.